Welcome back from the break, and thank you for staying with us here on the Morning Rush. And happy new month to all of you once again, wherever you're watching the show from across the country. Now, I mentioned earlier that we're going to have a conversation about our health. As always, on Wednesdays, we have Dr. Sherif joining us here on the show. And today we're talking about urolithiasis. And so if you're thinking what that is, breaking it down, you must have heard kidney stones every time. You're wondering what exactly these stones are. Do you have stones in our bodies, kidneys, whatever that is? So today he'll be breaking that down for us. So make sure that you do, follow keenly. And if you've got any questions, also you could write that. So as hopefully maybe we could open some the phone line so you could call and share with us, any of your issues when it comes to this particular topic. So let's get into it. Doc, good morning and welcome.
Good morning.
Happy new month to you.
Thanks so much.
Which month were you born?
August.
Okay, that's fine. So this is not your month, really.
Yes.
So urolithiasis, in other words, kidney stones. I have heard this over the period, but I haven't really paid attention to what kind of stones are in our kidneys. So just take us through that, the breakdown of what exactly this is about.
Yes. So kidney stones or urolithiasis is depositions that are formed within the urinary tract. So when we talk about the urinary tract, you are talking about the kidneys, you are talking about the ureters, you are talking about the bladder. This form the urinary tract.
Okay.
Now, deposits that are formed from minerals and salts in the body in any of these things. So kidney stones or urolithiasis can be found in the kidneys. It can also be found within the ureters that connects the kidney to the bladder, and it can also be found in the bladder as well. So any form of stone or any deposits that are found within any of these organs can be termed as kidney stones or urolithiasis. Now, they are actually formed as a result. Last week we were talking about urine retention, and we were talking about the fact that if there's urine retention within the bladder, some of the complications that it can come as a result of that. Now, when there's a concentrated urine in the bladder or in the kidney or any of these things, what happens is there's higher concentration of certain minerals that will predispose the kidneys or the bladder in forming hard substance. And some of these minerals are calcium, in some events uric acid, in some event even some infection and all those things. Because when the urine is concentrated in some of these chemicals, it will cause these minerals to stick together. You understand? So when they stick together, it becomes hard. It forms a substance hard like stone. You understand? So that is the genesis of how kidney stones are formed. So it is as a result of probably urine retention, probably from your prostate, from a UTI, any infection in the urinary tract or in the bladder that has contributed to some of these effects. But not just that, there are other situations that could predispose someone in getting some of these conditions, especially when, for example, you're having issues with absorption of, for example, calcium in the body. You understand? So there's malabsorption of calcium, so calcium will find itself in the urine. And when it becomes concentrated, there's less fluid in the body to dilute these minerals in the urine. And it will start sticking together, and it will form a very hard lump or a stone either in the kidneys or in the bladder. There are situations where there is dehydration. That is why it is very, very important to take in more water all the time. When you are dehydrated, it only means that the fluid content in the body is less, or the water in the body is less. And when the body is producing all these, minerals, these calcium, these uric acid, and all these components, components that form stones, there's a tendency of you to develop, a kidney stone.
Okay.
And then also there are some infections, because when you look at kidney stones, there are types. You understand?
There are types of it?
Yes, there are types of it. We have calcium stone, which forms about 80% of all kidney stones that we have. Yes, so especially when there's problem with your calcium, you know, as a result of metabolic disorder and all those things, it could lead to that. There's what we call a uric acid stones, and it happens when there's high uric acid levels in the blood as a result of metabolic disorder, as a result of some medications that you are taking and all those things, which could predispose you in developing what we call uric acid stone, which is also part of the urolithiasis that we are talking about. There's what we call struvite stone, and this happens usually from infections, recurrent urinary tract infections and all those things. You can develop a kidney stone, which is a struvite stone. And then also we have a cystine stone, which happens as a result when the body excretes specific amino acids. So you can develop a stone as a result of the fact that your body is excreting specific type of excessive excretion of a specific type of amino acid. So that is how come, you know, the body will develop a kidney stone.
A kidney stone. Wow, that's quite extensive, what you've said to us. So the coming together of these things, when they become hard, that's what we call them stone.
Yes.
And you alluded it to the prostate, I beg your pardon, and all of those things. So it means that people at that kind of age, those are the people, or it happens to anybody?
Yes, it can happen to anyone, because I mentioned that there are metabolic disorders that can lead to that. So even when you're eating and you're not eating well, it can predispose you in getting kidney stones. Yes, even if you are not rehydrating well, if you are not taking enough fluids, if you are not drinking more water, it can lead to that. And then also, there are certain medications that are used to treat conditions like migraine, depression, certain vitamins. When they are excess in the body, it could lead to that. Yes.
So there's no specific age range?
No, it can happen to the adult, it can happen to children. In fact, it happens to everyone. Of course, if there's infection, urinary tract infection, and urinary tract infection is common in children as well. So if there's recurrent infection of these things, it could lead to that. If there are an inherited disorder that probably you are excreting excess specific amino acid, it could lead to, you know, kidney. So it is a very, you know, broad something that affects everyone. It affects everyone, depending, even when you are obese, excess body weight, when your BMI is excess, it can predispose.
So everything excess in the body?
Yes, it can predispose. Yes, excessive salt intake. Yes, because when you take in more salt, the chloride in the salt will cause retention of excess calcium in the urine, which could lead to, you know, stone formation in the body. So the causes are enormous, and all these things that we are mentioning could predispose someone in getting a kidney stone.
How dangerous is this, and what threat does it pose to our health?
It is dangerous because, of course, if kidney stones are formed, for example, if it finds itself within the ureters, it could prevent someone from peeing, from urinating, because the ureters are more like a tubules that connects the kidney to the bladder. So, of course, if the stone finds itself and lodges there, it could prevent urine from coming down into the bladder. It can cause severe pain. Of course, people who have kidney stones, who probably might have experienced kidney stones one way or the other, very, very severe pain, a pain that moves down the ribs and radiates into the stomach. You find it even very difficult to pee. There are people who go through severe pain, severe form of pain when they are peeing. And then also, in an extreme cases, it could cause infections within the kidney. You understand? So there are a lot of situations where there's kidney damage, and the genesis of it was as a result of, kidney stone, because it can cause injury within any of these spaces, either in the bladder, the ureters, or in the kidney. It can also cause sepsis, that is a generalized infection within the body. So it is very, very, severe. But the good thing is, in all these things, if it is detected early, there are treatments, modalities, or there are things that we can do to help people who have kidney stones. Of course, at some point, depending on the size, some people can even pee
them out.
Yes, they can. There are situations that people can even pee them out when you give them medications, and some advices are pertaining to some of these situations.
Okay, so the same things that are what you've talked about, where you feel
so pain, dark urine. At times you see blood. Yes, at times you see blood in urine.
Okay,
it's very difficult. You are urine, very scanty urine at very intermittent, periods.
Okay,
and at times it's difficult to start urine to initiate stream. Pain that radiates at the back, the lumbar side, and it moves down into the tummy and all those. All these things can be signs and symptoms of kidney stones.
Okay, I've heard people say, so when you have these signs, then you go to the hospital. So let's say you go to Amen Scientific. I hear the stones will be crushed.
So it all depends on the type that you are dealing with, because identifying the type of stone that the person is having also goes a long way to help in treatment or managing situations. Yes, there are some medications that can be given to dissolve some of these stones that are formed. Because as I mentioned, they are formed from these minerals, these calcium oxalates, calcium phosphate, or some infections and uric acid and all those. So if there are medications to help dissolve some of these things, yes, it can be given to help this situation. But in an extreme situations, surgery is also recommended. Surgery. Yes, in an extreme, because of course, if the stone is so hard, it's so big, and medications are given and you are not seeing any results, then surgically, they can be procedures that can take these stones out, either from the bladder or the ureters, or even in the kidney, to help solve the situation. But of course, there are medications. For example, when you come to Amen Scientific about an alternative medical hospital, there are medications that we can give to help dissolve some of these stones that are formed as a result of this condition, and within a very short time. But of course, if you are given medications to take care of these situations, you need to be guided in terms of what you eat, the things you do, and all those things, which will prevent the condition from coming again, because there can be recurrence. Yes, it comes, it goes. If you still do the same things that you've been doing that caused the condition, there's a tendency of it coming back again.
Okay, well, if you just tuned in, we're talking about kidney stones this morning, and I'm learning a lot. In fact, when everything is in excess, you can get kidney stones. That's basically what Doc is sharing with us here, Dr. SHERIF Okyeere from Amen Scientific. And so we've talked about the treatment modalities. There could be medications, and in the extreme cases, surgeries. Yes. In the very extreme cases, would people die? Would one die?
In fact, mortality rate for kidney stones is very low.
Okay.
Yes, it's very, very low. But then, of course, in an extreme cases where sepsis and all those things come in, there's a tendency of someone dying as a result of kidney stones. Okay. But the mortality rate is very low.
Okay. So that one is okay for me. so that we can work towards the treatment.
Yes.
Stuff like that. So in Ghana, or let's say Amen Scientific, on a regular, what's the data like?
Yes. So it is not so common.
Okay.
But all the cases that we've had over the time, we've been very, very successful when it comes to kidney stones, because I think about 2 months ago we had a case like that, and the woman was so big. There were some underlying conditions, diabetes, metabolic disorders, and all those things. And then, of course, there are people who do bypass, gastric bypass, especially people who want to lose weight and all those things. When it happens that way, because absorption has been affected because of the bypass, it could also predispose you in getting some of these conditions. But the case that I was talking about, this woman had underlying conditions. She was so big, and the stones, it wasn't just one. I think a couple of them, about 3, when we did a scan and we did some other distance. And I think just about 2-3 months, everything has gone off.
Left.
We gave medication, we advised on the things that she's supposed to do and things not that she's supposed to stay away. And within that short time, she was fine. All the pain, because the pain is very unbearable. It's very, very severe, especially when you want to pee. And this woman, after some time, she was fine, and right now she's not having any of these things. So if you are watching us and you are showing these signs, your urine color is changing from brick red to brown to pink and all those things. At times you see blood in the urine and all those things. You're finding difficult. There's always pain at the lower back, which at times radiates into the abdomen and all that. I entreat you to visit the hospital. And if you're having any of these challenges, you've gone to the hospital, you've been diagnosed of having kidney stones, I entreat you to come to Amen Scientific about an alternative medical hospital, because in fact, you just come. You just come.
He's given a testimony of that of the woman. And so if you go to the washroom and you urinate and you see that color of your urine, if you won't go to the hospital, there's a problem. But you need to go to Amen Scientific so that they could work on that for you. So the numbers are on your screen. So call the numbers and speak to Doc and his people from Amen Scientific Herbal. And of course, the locations are across the country, but the major ones.
Yes, across the country, in Kumasi, in Takrady, Hohohoi, Tamale. And in Accra here, we have one at Domin, close to the Snet Flats, and Lashibi Klagon, close to the Ashamai Underbridge. In fact, you can call the number on the screen, and anywhere close by to you, will direct you to come. And if you're having any issue that has to do with your urinary tract, talk of the kidney stone, the urine retention that we spoke about last week, and any other condition, just contact Amen Scientific Herbal, an alternative medical hospital, and by God's grace, we'll help you out of that.
By God's grace, you'll be helped out of that situation. Thank you very much, Doc, for coming in this morning. So Dr. SHERIF Okyeere is an alternative medicine practitioner with the Amen Scientific Herbal and Alternative Medical Hospital. As always, join us on Wednesdays to talk about our health, and today we talked about kidney stones. So do well to call the numbers so that they can sort out your health issues for you.